Is your thyroid sending you distress signals? Would you know how to spot the early warning signs that your thyroid is in trouble? Well, in this video, I'm going to cover the early warning signs and the essential symptoms you need to be aware of. What is your thyroid? Your thyroid is a small butterfly-shaped organ that sits at the base of your neck, so just below the center of your throat. It's part of an essential system in your body called your endocrine system. Your endocrine system is essential for coordinating lots of different important functions in your body. And your thyroid gland produces hormones that help regulate your metabolism. This means that your thyroid has an essential role in your metabolism. This roughly means how quickly your body uses energy. This then influences your digestion, your heart rate, and your temperature. So key functions in how your body works. What causes thyroid problems? Several problems can happen when your body produces too much hormone or too little hormone. We generally label this as hyperthyroidism and hypothyroidism. So that means when your thyroid gland is overproducing or underproducing essential hormones that your body needs, you will have warning signs. Some examples of symptoms that you may get are irritability, mood changes, weight loss or weight gain, feeling really tired. Now I'm going to go through some of the important symptoms you should be aware of. Tiredness. One of the key signs that you might notice with hypothyroidism is tiredness. This is different to being tired after a long day at work or if you've been out and about too much. This is usually an overwhelming feeling of tiredness, which means you cannot do your normal routine or you notice your energy levels are gradually declining. If you're noticing persistent tiredness, it's good to see a doctor because there's many other causes like anemia, changes in your weight. You go on the weighing scale and you notice that there's a sudden shift or a gradual change and you're not sure what's going on, well, your thyroid could be the culprit. Hyperthyroidism normally pushes up your metabolism and therefore makes you lose weight, whereas hypothyroidism slows down your metabolism and most people notice that they start to gain weight. Vision or eye problems. Another warning sign of thyroid problems could be changes in vision. This can happen with hyperthyroidism and hypothyroidism. With some causes of hyperthyroidism, like Graves' disease, it could lead to eye changes like bulging of your eyes. And in some cases, people with hypothyroidism may also notice changes with their eyes. Although your vision isn't directly affected with hypothyroidism, thyroid hormones do play a role in how well your tear ducts function. So some people with hypothyroidism notice that they get more dry eyes or in some cases more blurry vision. If you are noticing that you're having eye changes or vision changes, remember that there are other causes which might be at play. Digestive changes, changes in your gut. Gut troubles like bloating, nausea, or constipation can be more than just a passing issue that you're experiencing. It could be related to your thyroid. Hypothyroidism can affect your digestive tract because it slows down your metabolism. This can sometimes lead to an imbalance in the bacteria that regulate your digestive tract. You may end up with too much bacteria in your gut that can lead to symptoms like stomach pain, diarrhea, or in some cases bloating. Number 5, sensitivity to temperature. Feeling unusually hot or cold, you're wearing more layers than you used to, or you're taking off layers all the time, well, your body's thermostat might be out of balance due to problems in your thyroid. Thyroid hormones have an essential role in regulating your temperature. With hypothyroidism, you might notice that you're feeling cold all the time. And with hyperthyroidism, you usually feel really warm and hot and sweaty. This is including when you're around other people and you notice that they're wearing a lot more layers than you are. Skin and hair changes. Your skin and your hair can also relate to how well your thyroid gland is working. Dry, itchy skin or brittle hair could be a sign of hypothyroidism. This is because your thyroid hormones play a role in your hair growth. And that means with a low level of thyroid hormone, the growth of your hair can get affected. Sleep issues. Have you noticed that you've started tossing and turning more at night? Well, your thyroid might be keeping you up. Both hyper and hypothyroidism can affect your sleep. It's more commonly seen with patients with hyperthyroidism, and that's because they have high levels of hormone that makes them nervous or anxious or trembly, which means they may find themselves more alert than usual and have trouble getting to sleep. Also, the increase in hormone might make them really hot and sweaty, and therefore at night they're noticing that they're sweating too much and it's keeping them up. Period changes. Thyroid hormone also have an important role in regulating your periods. Some people with underactive thyroid may notice that the period pattern changes. This might notice that your period pattern becomes irregular. You start to notice they're lighter, or you're skipping some periods. If you have an overactive thyroid, you may in some cases notice that you're having periods more frequently than usual. So what's the next step? You've noticed you've got some of these symptoms, you're not sure what's going on, and they've been persisting for a little while. Well, in my clinic, I often see patients with thyroid problems. Usually I'll start by asking them a range of questions, checking how long it's been going on for, and examining them. An examination will usually include me checking their blood pressure, their heart rate, checking their observations, and feeling their neck. In some cases with a thyroid problem, we might notice something called a goiter, which is a lump in your neck. Then we'll usually need to do some investigations like a blood test or an ultrasound to have a closer look at what's going on. Some urgent signs we need to see a doctor. Rarely, some people with an overactive thyroid may need some urgent medical support. And I'm going to go through the signs you need to be aware of. If you notice your heart is racing, your temperature is raised, your blood pressure is high, you've got yellowing of your skin or your eyes, or you're feeling very, very agitated, this might be a sign of a thyroid storm. This is an urgent medical condition when your thyroid hormone has become too high. It's generally rare and not seen very often, but is usually triggered by things like an infection, pregnancy, not taking your thyroid medication properly, or your thyroid gland has become damaged. How do you treat thyroid problems? The treatment will depend on your exact symptoms and your health history. It also matters if you've got hyperthyroidism or hypothyroidism. The medication and treatments we use are different. Can you cure thyroid problems? Most thyroid disorders are effectively managed with treatment, whether that means medication for you or potentially surgery. For people with hypothyroidism, so underactive thyroid, you normally need lifelong medication so we can replace the thyroid hormone. Thank you for watching, and if I can ask for a favor, if you click the word subscribe, it really helps my channel to keep on growing. Also, if you have any questions below, please write them and I can get back to you. Thank you for watching.